Let's begin with a very crucial update. As the holiday season approaches, the festive cheer has been dampened by horrific videos of bodies piling up at hospitals in China. An epidemiologist has projected that 60% of the country's population could end up getting infected over the course of the next few months. Other reports also suggest that China is running the risk of around 2 million deaths by the end of next year. And driving this surge is a new subvariant of Omicron, BF7. This variant is said to have higher is more transmissible and is also immune evasiveness than the other versions that we have as of now. This means that it's more difficult for the antibodies from even vaccinated or infected individuals to destroy it. Now, 4 cases of this variant have also been detected in India. 3 in Gujarat and 1 in Odisha. So one of these patients, a woman with a travel history to the United States, was found BF7 variant positive on the 18th of November in Vadodara, but recovered just after home isolation and is now in a normal condition.
જોઈએ તો તમામ નાગરિકો તમામ લોકો તકેદારી રાખે એ ખૂબ જરૂરી છે. અત્યારે એક નવા વેરિયન્ટ BF.7 જે છે એ દેખાયા છે. વડોદરા શહેરમાં 11/9 એક જે લેડી એ અમેરિકાથી આવ્યા હતા અને 18 તારીખે એમનું કોવિડ પોઝિટિવ થયું હતું. એનું જે સેમ્પલ છે એ સેમ્પલ જીનોમ સિક્વન્સિંગ માટે મોકલતા એ BF.7 જે છે એ વેરિયન્ટ મળ્યા છે. એમાં સિક્વન્સિંગમાં ખબર પડ્યા છે.
But the Indian government is already on its toes. The Union Health Minister chaired a high-level meeting with key stakeholders yesterday, and while assuring one and all that there is no need to panic and India is well prepared for any situation, he also directed all the concerned to strengthen surveillance and vaccination coverage. Now, from random screening of international passengers at the airports to ramping up testing and making genome sequencing mandatory for all the case testing positive, the centre is ensuring the shield against COVID is foolproof.
18 के ऊपर प्रिकॉशन डोज सबको लगनी चाहिए, लेकिन लगी है सिर्फ 27-28%. तो हम अपील करेंगे कि प्रिकॉशन डोज जिसको नहीं लगी है वो ले लीजिए. ये भारत की पेंडेमिक रिस्पांस का एक पिलर है. ये मास्क मैंडेट जो है अभी भी यही है जो मैं कह रहा हूं और उसी को ही रहना चाहिए. अगर जरूरत होगी तो गाइडलाइन को इम्प्रूव करेंगे. वी आर कॉन्स्टेंटली वॉचिंग.
देयर इज नथिंग टू बी पैनिक्ड अबाउट. देयर इज नो नीड for getting too much worried on this issue. The system is very vigilant. Situation in India is under control.
मैं भारत सरकार का हेल्थ मिनिस्टर होने के नाते मेरा दायित्व है कि देश में कोविड ना फैले, देश के सभी नागरिक स्वस्थ रहे, कोविड प्रोटोकॉल का पालन करके कोविड ना फैले उसके लिए कोई मार्गदर्शक सूचना जारी करें.
But there are some concerns. With only 27 to 28% people inoculated with the booster dose so far in the country, questions are now being raised around whether India is prepared to tackle any impending crisis. Experts point out that there are several factors that indicate that things may not be as bad for us as for China, because Indians have hybrid immunity from previous infection and vaccination, and while BF7 accounted for more than 5% of the US cases and 7.26% of the UK cases in October, there was no dramatic increase in the number of cases or hospitalizations in these countries. This means that the situation in China could have been worsened by its immuno-naive population, its hard lockdowns and not so effective vaccines.
There should be no worry for Indians because we are extensively vaccinated and with a very effective vaccine, the Covishield and the Covaxin. So there is no worry that the cases would go up here. Yes, because of the bad air quality index, we are seeing a lot of non-COVID viral infections on the rise.
It's a fear for India as well. So I think the government of India must have issued some directives government of Maharashtra, especially the health department, should follow on those directives immediately. There should be a testing should be done for the genomic sequencing.
Indians are quite safe because of the effective and successful implementation of the vaccination. When 100% of our population is completely protected with the vaccines, with double doses, even those people who have not taken third dose, I appeal to all of them to take this booster dose at the earliest.